Good morning, everyone. Dr. Christine Smith here. So I have a really cool live for you today where I'm going to be talking with two other practitioners who I just love working with. We have known each other for many years, and we all work in the same of basically how to really work with foundational medicine. Oh, good. Here's one of them. Great. Here's both of them. Hello,
We got it.
Ellen. Yes. Okay. So this is Dr. Ward. And Dr. Ward basically kind of works with a lot of gut, skin, and hormone stuff, as well as bone density issues. And so we're going to kind of dive into that. And then Dr. Janji is an SMET candidate in internal disorders and nutrition. And we all kind of work on formulating really specific care plans for people that addresses the whole person. And the reason I invited them on is because we all share a fundamental view and philosophy on how the body works and where disease comes from and how to prevent it. So this is a lot of what we're going to be talking about today. And I want you guys to ask questions if you have questions, and we'll try to answer them. And I just thank you guys so much for making the time to do this today, because you're two of my favorite minds. So good morning. Hello.
Hey,
Good
Doc.
morning.
Thank you so much for having us on. It's pretty exciting.
Yeah,
Can
absolutely.
you hear me?
Yes, we can.
Oh,
Yeah.
okay, awesome.
Dr.
Perfect.
John,
So,
you're actually breathing a little bit into your mic. Sorry, just
Got
wanted to, so we can. There we
Okay,
go.
all right. I think we're good right here, right?
Okay.
yeah,
Yeah,
that's
sounds great.
perfect.
Okay, awesome.
So, and for anyone who doesn't have audio, it might actually be something on your phone. So sometimes you just have to turn up the volume or make sure you're not connected to a Bluetooth speaker, that kind of thing. However, this will also be recorded and I'll post it later. So if for some reason you can't hear it now, you should be able to hear it later. But why don't we start with you guys introducing yourselves and just talking a little bit about like what you do and what you like to teach your patients and what you think is the most important thing for them to know. And then we can kind of do what we discussed, where we're going to take people through the stages of like, what are some of the events that can actually initiate disease that you wouldn't really think about? And how does the whole cascade happen? And why do things go down different pathways? So Dr. Ward, let's start with you.
Yeah, so what I love to teach my patients is that disease does not come from just one place, and it does not have just one solution. So usually what I tell my patients all the time is that all disease starts in the gut. And that might sound dramatic, it might even be a little bit of an exaggeration, but usually the inflammatory cascade that starts disease begins in the gut. And what they say a lot of times too is 95% of disease is from lifestyle choices, not genetics. And a lot of our lifestyle, whether through a stressful lifestyle, dietary choices, all has an effect on the gut that starts the fire that then cascades in a lot of other different tissues, and can cause a lot of problems. So whether that's hormones, bone density, thyroid conditions, all those types of things, that's what I like my patients to think about. There's a root cause to everything, so let's look for it. And the solution is often a lot more simple than anyone can imagine. And when you focus on the simple things, healing is hard, but methodically simple. So,
Yep.
Yeah,
I think
that's
that is
that's
beautifully
beautiful.
said.
thank you.
When he was saying that, I was thinking of like, okay, how am I going to explain this? And this a perfect analogy of like whenever you're at a concert and you become one with the music, that you feel great, right? Whenever you're one with nature, the body also doesn't express disease, at least from like me and many other doctors would probably agree with that statement. So like getting your meditations in, getting, touching your food, having a relationship with your food, relationship with your spirit, yourself. If you believe in spirit, your spirit. So it's like, I feel like that's that song at a concert, and, being one with that is really important.
Absolutely. No, I think that's beautifully stated by both you guys. And this is why I love doing this stuff, is to help shift the paradigm of how people view what health is. And I think a lot of people think that it's a destination versus a maintenance process and a state of keeping yourself balanced. And Dr. Janji, I'm so glad that you brought up like the spiritual component for, just for language and for anyone. I call it an energetic component. It's your energetic body. We measure people's brain waves with magnets that don't touch their head. You emit your own energetic signal, like it's a part of your being. Everything on this earth emits its own energetic signal. And you can also learn how to work with that energy to facilitate your own healing. But it can't be the only thing, because, we also have to feed ourselves right and nourish ourselves properly. And that is where the gut comes in that Dr. Ward was talking about, which I couldn't agree with more. And both of these guys and myself work a ton with gut. And it's because it is so foundational, and it's where the majority of your neurotransmitters come. Just like fun fact that most people don't know, your gut actually has as many neurons in it as a cat's brain.
Nice.
Like, let that sink in for a second. Like, your gut is a huge part of your health, and there's actually more signals going from your gut to your brain than there are from your brain to your gut. So your gut is like this incredible monitor of the outside world, and that's why so many things are tied to it, is because it is a foundational component. And actually, I'm really glad that you guys brought that up, because I do think it is the first step in the disease cascade, and then we can talk about all the things that come from it. So when I, educate people about gut on this channel, the last talk that I just did was about head injuries and how it can actually create leaky gut to have a head injury, which a lot of people don't know. And then that can turn into basically you no longer having a protective barrier between the potential pathogens of our environment and your internally clean body. And this is where some issues can start to happen, as we basically get what are called subclinical levels of endotoxemia, meaning like your own blood is becoming toxic from food particles and bacteria leaking through when they're not supposed to. And so that leads to a whole bunch of health cascades. So, and I see a lot of questions here. So I think we're gonna address a good portion of these. So people are asking about sleep. Yes, we are in the US. And then NMT, I'm assuming you're meaning neuromuscular therapy. And yes, we all do body work, and we think it's an incredibly important. And then things like, vitamin IV drips. So we can share our thoughts on those kinds of things. But let's just start with the mechanism of leaky gut. And I'm going to pop over to Dr. Janji, because he was actually one of the first people to really give me a thorough education back in the day on some of the mechanisms of it. So I would love if you would touch a little bit on what you like to educate your patients about when it comes to mechanisms of how leaky gut happens.
Absolutely. So the gut, really, you can think of it's a tube from your mouth all the way to your back end. And I laugh when I say this, but like the human body is really like a human donut. It's just that there's a hole and in between, and then like is the human body. And a lot of patients they think twice whenever I say this, but once you swallow food, it's still outside your body until it passes your gut lining. Then it's inside your body. So everything till then is a story of pH, is a story of relaxation, is a story of anatomy. So let's go ahead and break down the anatomy. So I don't want to talk about stomach right now. I want to go straight to the gut. We can tap into that because it's really important. But the gut, in order for it to absorb anything, it goes through two pathways. It's a paracellular pathway, which is para meaning next to. So if you think of the gut as let's just take a little centimeter of the gut, and it's just like these squares that are right next to each other. Paracellular is what goes through these squares. Transcellular is what passively diffuses through these squares. So these two mechanisms, essentially, we can now say, okay, so when we talk about leaky gut or intestinal permeability for the more scientific term, what pathway is being broken down? I would argue that both are being broken down, but in the literature, when we talk about intestinal permeability, it's the paracellular
between the squares.
Exactly, between the squares. Thank you. So the anatomy of that is just that. It's basically like these squares that are in our gut, and they have hairs on top of it, and on top of that there's mucus, and there's bacteria and viruses and the whole microbiome there. So they need to have a synergistic effect in between each other. And this is where Christine's and Jarod's work comes in really importantly, because like Christine mentioned earlier, if a bacteria ends up in the blood and creates a slight endotoxemia, that bacteria's feces can also cause endotoxemia. So that's the difference between like a bacteria that slips in or the byproducts of that, the toxin of the bacteria. Then there is alcohol consumption. Then there's nutritional deficiencies. Then there's lack of relaxation response. And the list goes on and on. And you just create this environment in the gut where is it thriving or is it not thriving? And intestinal permeability is this pattern of non-thrivingness, if you will. And then the doctor has to come in, fully educate that this is a very big commitment in order to heal this gut, because it's going to pay major down the road.
Yep. I think that was beautifully stated. So this is great, right? Because this is what I love to do for you guys on this channel. I want to educate you about your own physiology so you have an understanding of how your body works, because I think it's one of the things that gets completely skipped over in healthcare is like understanding how your body works. Like, yes, I can take my car to the mechanic and he can just fix it and I can drive away. But sometimes I like to know what they're doing and why, and like what purpose does it serve, and I like to have some knowledge about what's going on. So one of the questions that popped up that I think will actually blend beautifully into this little pathway we're going down, I'm going to point to Dr. Ward. There's a question about, can poor gut health mess with your sex life? So let's talk about how it can affect hormones and how that can cascade.
Yeah, so first of all, I would say definitely, okay, because a lot of times when I see poor hormone function, the root cause of poor hormone function can be involved with levels of systemic inflammation. Okay, and like I said, all inflammation, and that's where we get a lot of this inflammation buildup.
Uh-oh. There you go.
So yes, and then also a lot of our neurotransmitters are made in the gut. So serotonin, norepinephrine, things like that. And the sexual response relies on a healthy activation of the nervous system. Okay, so you need the neurotransmitters working, piling up so that you can have a proper sexual response. And then also, I think about the microcirculation, right? So for sexual function, you need all the tiny blood vessels to be working, okay? And so a lot of diabetes, metabolic health, those are very related. You've probably heard about diabetics getting the tingling in their fingers. That often has to do with neurological component, but also a blood vessel integrity component. Those diseases, in my opinion, begin in the gut and have a bit of, and also obviously have pancreatic and liver involvement as well. So it's all very interwoven. And then this also brings up a good point too in terms of actually estrogen. So there is a specific part of the gut microbiome called the estrobolome, which just basically means estrogen microbiome. And it is a group of bacteria that their main job is to make an enzyme called beta-glucuronidase. And what that enzyme does is it helps break down and helps the body recycle estrogen. So why this is important for both men and women. Men, if you have too much estrogen, you're going to get, a little extra fatty tissue in the chest, which no guy really prefers to have, right? And then that can also mess with sexual response, okay? And then, so we want to make sure that estrogen is being properly detoxified. So that means having a healthy liver and a healthy gut microbiome, okay? And then we also want to make sure for women that we don't get too much estrogen accumulating, because there are a lot of estrogen-related cancers. Well, there are some. And I do a test called the Dutch test, which they probably have heard about as well, these guys. And what that does is it shows how there's 3 types of estrogen breakdowns. There's the 2-OH, the 4-OH, and the 16-OH. They're called estrogen metabolites. Lots of details, but basically there's good estrogen, there's neutral estrogen, and there's not so good estrogen. And the not so good estrogen is the 4-OH, and that can predict, with the Dutch test, estrogen-related cancers developing 5 to 10 years down the road, okay? So anyways, gut microbiome is really important for hormonal health, not only for sexual function, but also to make sure that your body is healthily detoxing estrogen, so you're at a lower risk of developing an estrogen-related cancer. So not to mention high estrogen going with like menopause, hot flashes, all that kind of stuff that will make your life a lot easier. But that also has to do with quality of life, so.
Yep, beautifully stated. So I love this, right? Because this is why nothing is separate. Like everything is interactive. And so the other thing that, like when we're talking about gut health, so let me just paint a picture that people can probably kind of relate to, right? So I'm gonna start to paint this cascade of like how disease can start to occur, and jumping on exactly what they just said. So let's say you get in a car accident. Okay. And that's an injury. Not that bad. You just have some whiplash. Like you're okay, but your back hurts for the next few months, and you do all the right things. You like work with a PT, you see your chiropractor, you do the body work, all that kind of stuff, but you're still just like kind of struggling. And then Christmas rolls around and you're drinking all the coffee with half and half and full cream and eating desserts that have eggs and gluten and dairy, and then all of a sudden in the new year you like have this weird rash, or you're having some brain fog and you're just not feeling great, and you have this New Year's resolution to like do all the things right and get up on your health, but you just have no energy and no motivation for it. And you're like, man, this just feels weird. Like, why do I have no motivation? I don't really understand why. This doesn't make sense. Like, I'm not usually this person, but oh, I just feel like apathetic right now. And I just I can't quite get myself there. So a lot of people, going back to what I said in the beginning, don't realize that an injury can actually induce leaky gut, especially something like whiplash, which can also be to an extent, a very minor concussion, because a lot of people don't realize that the sheath that surrounds your spinal cord, called the dura, is also the thing that surrounds your brain, and it can basically get sprained in something like whiplash. So now you basically have this sprained brain, or sprained surrounding of your brain. You also have sprains in your back. Your body has gone into a state of inflammation to heal these things, and then at the same time, because of the injury and because of the state of inflammation, all of the tissues in your body become a little bit more permeable to let your immune cells through so that they can do the healing, right? This is a normal response. As we become more permeable, that also affects your gut. And then here we are eating all of these foods that normally we can handle. Like, I'm going to be honest, I don't think that processed dairy and gluten is particularly good for anyone, but most of the time we can handle it. But if you have leaky gut, then these things can start to really take a toll. And when we come back to talking about the little tight junctions that Dr. Janji was talking about, they are connected through basically little molecules that hold them together. And when we get permeable, they start to get some space. And then things like gluten can activate an enzyme or a molecule called zonulin. And then zonulin can start to disrupt these little things that hold us together. And then we start to get even bigger spaces, and then even more things can leak through. And then we start to get this level of endotoxemia, and our body's like, oh my gosh, there's not supposed to be bacteria in the blood. We need to go attack all the things, upregulate all of the immune teams, like upregulate everything. And then your immune response starts upregulating, and the particle of banana that leaked through that should be totally like innocuous, your body's like, oh my gosh, I'm on high alert. That's not supposed to be here. Attack that too. And now suddenly you have an antibody to bananas. And it's creating this like weird inflammatory response because it's upregulating your immune system, but you don't realize it because you've never had a problem with bananas before. And then now you're like in this inflammatory state months and months and months past your injury. Fun thing about inflammation, it upregulates all of your stress pathways. And I want Dr. Janji to talk about the relaxation response when I'm done here, because it's super important in your healing. And this is why. So when we upregulate the stress response, which is a cortisol response and an adrenaline response, we actually use the building blocks to make it go. And this is the response that's supposed to be like running from the tiger. And then when you get away, it's supposed to turn off. But in today's society, we get upregulated for months or years on end, just because of all the stuff that's going on in the back of our brain. Oh, I need to pay that bill. Oh, I need to get back to those 50,000 emails. Oh, I have this thing coming up. Oh, I'm worried about somebody else and something I don't have control over. And so we like end up in this stress state. And then we start using our building blocks for things like our dopamine, because tyrosine is the building block for epinephrine. And it's also the building block for your dopamine, and it's also the building block for your thyroid hormone. So if you're in a stress state, you are stealing from your own happy motivation chemical, and you're stealing from your hormone that allows you to produce energy. So now you feel unmotivated and fatigued, and you don't know why, except the reason why is because you're in a state of subtle inflammation that you don't know how to identify because no one's taught you, which is exactly why we do these talks. So there's a little like image for you that hopefully you can relate to. But yeah, I guess either one of you can comment on that. I'll start with Dr. Janji, and then Jarod, Dr. Ward, I'd love to hear your thoughts on that too.
It's really nice how you painted a picture on like the injury that happened, and then the holiday season and the decisions that were made during that. And then the patient came to see you, and you had to let them know like, hey, there's subtle inflammation going on, and doctors like us, that's what we're really good at, is we're really good at finding those subtle inflammations and quenching it and getting the person catching it early. And it's loopy, it's a vicious cycle. It can get bigger and bigger. So you just remind them of that. The relaxation response is really important as well, because although we do have these inflammatory processes going on, we can't lose sight that we are still very powerful as a singular identity. And that's what the relaxation response enables you to tap into. I don't know if you guys have heard of Dr. Joe Dispenza's work, but he pretty much travels the world and teaches people how to meditate so deep that they forget that they are in a human vessel. They just gets them to a place where they're he calls it in the blackness. Black to me is a dark color. I like to say whiteness or something. I don't know. Like
I call it the space of potential energy.
There you go. In the light, in the lightness.
This is how you know like your doctors are meditating, because we're like creating synonyms as we go here. That's so funny. So yeah, so if you can meditate like 10 minutes in the morning, 20 is even better. And again, before you sleep, it sets the tone not only for the day, but the day after that. And it allows the supplementation and the lifestyle habits to also sink in together. Like we've been talking about since the beginning, like this is a very multifactorial healing journey. And it's, you know, we can't just say, I'm taking my supplements and, you know, I'm doing really good with the diet, but my stress is still 9 out of 10. Like that's still incomplete. Right. It's like the water boiling effect, which I forget which teacher I learned this from, but water boils at a certain Fahrenheit. You know, so if we're doing something that is right before that boiling point where it transforms from liquid to gas, then you're not at that boiling point. So we need to do that extra step in order to experience that transformation.
Absolutely. And I saw, just before I hop up over to Dr. Ward, I saw a question that said, like, what if you're in subtle inflammation 14 years past an injury? Yeah, that's the exact cascade that we're discussing here. And that's where people can get stuck. But it is possible to get out of it with the things that we're discussing. So I want to pop over and hear Dr. Ward's thoughts on that. And then we can kind of talk about more of like how these things can cascade down certain pathways and what sorts of things we do to prevent them, and the relaxation response or meditation. And it's more than just, I mean, there's a lot of different kinds of it, so we can touch more on that too, but it's more than just sitting there in silence. That's one type, but it's really about what you do with your brain and your imagination while you're in that quiet space and taking time for your body to exist there. So Dr. Ward, I'd love to hear your thoughts on what we're talking about.
Yeah, okay, so I have a couple of thoughts. You guys are just bringing up so many good points. And also, I don't know if everyone knows this. We all went to school together, and I hope that's okay that I tell everybody that. So if you see little moments of informality, that's why, because we went through the trenches of grad school, doctor school together, so we're all pretty familiar with each other. But I wanted to just kind of highlight a little bit more how the leaky gut connection, when Dr. Christine was talking about things leaking in, and then all of a sudden you have this response to a banana. I wanted to talk about how basically when that happens, think of the particle of banana as a certain shape, right? And the body's going to be so alarmed about, oh my gosh, now I don't like that shape. It's going to look for anything that closely resembles that shape in the body. That's the immune system doing its job, right? It's like, this isn't supposed to be here, so I'm going to eliminate it everywhere it shows up. Unfortunately, I forget the exact scientific term for it right now, but for example, gluten is a big thing that a lot of people are super sensitive to. And when people get sensitive to gluten because it's leaking into the bloodstream, there is a cross-reactivity with thyroid tissue. And so what oftentimes people, when they get Hashimoto's or an autoimmune thyroid condition, one of the first things that even a lot of primary care doctors, mainstream medical doctors will recommend is going off gluten, because that will cause the further thyroid fire to accumulate if you keep eating gluten, right? So I just want to kind of highlight that most autoimmune conditions, well, I'd say all autoimmune conditions begin in the gut. And we're not really a culture of like really crazy bacterial or viral infections that often. Most of the time, we are a chronic disease and autoimmune and cancer culture. Okay, those are our issues. And most of those issues can be addressed years before they happen, but you have to be proactive. You have to have someone in your corner that is a preventative mindset doctor or practitioner. So I just wanted to highlight that. And then also just to kind of echo what Dr. Christine said again was like, this was literally my story. I went to Kenya with my dad. My dad is a surgeon, and he would always go on medical service trips and set up a clinic and see a ton of crazy cases, you know. And I went to Kenya and I got I'm not even really sure, but I got sick for 4 years after I came back from Kenya, and my gut was messed up. I had parasitic infection, bacterial infection, but I didn't know about it. And what's crazy is traditional lab work and blood work did not find it. Basically, so anyways, long story short, I had to focus on healing my gut, and I did a food sensitivity test, which measures IgG response. So that's not like, oh, I'm allergic. It's a slow building inflammatory immune response to tests. And I was allergic or sensitive to 27 foods, which is a lot, right? And a lot of you guys, if you have had leaky gut or like a 14-year inflammatory cascade from a head injury, will probably test to a similar number of foods. And the solution is not necessarily avoiding the foods forever, maybe for a season to just calm everything down. The solution is to heal the gut. And Dr. Janji brought up some great points, especially with nervous system tone. That's what I kept hearing from both of you guys. Nervous system tone is so important, and that has to do with the vagus nerve. So the vagus nerve is the main cranial nerve from the brain to basically all the organs in your body, and it either tells them to freak out or calm down. That's the simplicity of it. And when you're telling your brain, okay, I'm going to be calm right now, no matter what is going on in the world, you know, and in my life, you're forcing the vagus nerve to also send those calming signals to the rest of your body. Thank you. Molecular mimicry. Thank you, Dr. Tracy Lee. Shout out.
That was a really good question. Someone asked, how do I know if I have leaky gut? And yeah, this goes down to the anatomy of it too. Remember how I talked about, maybe you jumped on a little bit later. It's okay. There's mucus in the line. Like there's so many layers before we hit a pain nerve inside of the gut. So you don't get pain to have leaky gut. You get bloating, you get, bloating is like the most important one. Belching.
Even just like headaches. Sometimes
right, yeah.
It's not even your gut. But yes, keep going.
Such an important question. And yeah, I mean, even the herbs to take care of, leaky gut. One of the mechanisms for leaky gut can be infection of a species of bacteria or viruses or parasites that are they're not being maintained by the immune system. So we need some sort of help from the outside. And because us three, we don't have pharmaceutical rights, we have herbs. That's our apothecary. So we look in our cabinet.
By choice, I might add, by choice.
You're a savage, Jared. And no, I would say the same thing. And yeah, so like one of the main ones would be berberine, for instance. And there's research to show that what's really cool with berberine is that it can actually go after the bad microbiome versus the good one. So it has like this sensory intelligence to it. Instead of being a broad spectrum antimicrobial, it can tackle the ones that actually the body would want to rid of. Right. And not only that is when you mix it with things like milk thistle, thanks to Carrie Bones research, we know that it goes inside of the body and can help with so many insulin resistant rooted diseases, from PCOS to fatty liver to migraines to Lord knows. I mean, the list is on and on.
I just want to echo my love for berberine. I use it for so much stuff. I mean, it's often nicknamed nature's metformin because it's so good with insulin response and people with like blood sugar issues. And also, I just think it's epic that it is designed to destroy the bad bacteria but leave the good ones alone, versus an antibiotic is like a nuke to your whole system. And then what else I was going to say? Oh, and I use berberine for infections too. I've even seen success berberine with chronic Lyme disease. That is because it penetrates usually deep into the nervous system, which can help with that condition as well. So there are so many solutions. I get so excited about it. So,
oh man, it's so nice to talk to you guys. I love just hearing your thoughts on this stuff. So I also want to kind of go over like how to identify leaky gut, because a lot of what I teach on here is how to listen to your own body and how to hear it. Like it speaks to you. We just were never taught the language. And so the language of what we're talking about, I'm just going to give you a very quick, pretty long list of some of the stuff that can actually be tied to your gut. So overall body feeling, dense, heavy, feeling puffy and thick, autoimmune disorders, weight gain, digestive symptoms, constipation, diarrhea, reflux, frog in your throat, that clearing the throat, itchy throat and tongue, having a coating on your tongue, brain, feeling irritable, depressed, anxiety, brain fog, blurry vision, headaches and migraines. Energy can be fatigue and lethargy, skin, flushing, spots, acne, a rash, feeling itchy, feeling swollen in the morning. Like if you gain 5 pounds overnight, you ate something the other day that you were sensitive to. We don't gain weight like that. That's water weight. That's inflammation weight. So watch yourself over the holidays. And if you wake up in the morning, you're 5 pounds heavier. It's not just the food, it's the type of food that you ate and your body's response to it. And the nails, like if your nails are flaking, if your hair is falling out, these kinds of things can also be downstream effects of different organs in the body that are being affected by the gut. And it can also be nutritional deficiencies, because one of the other things that happens with gut stuff that Dr. Janji was talking about is the mucosal lining starts to deteriorate. And this can happen with things like an injury or a head injury. And now I'm also going to shift the paradigm of what you think of as an injury. If you guys watched the recent live that I did with the TBI expert, the traumatic brain injury expert, he stated that PTSD counts as a head injury. And it does. And you can have PTSD from a variety of experiences, and it's all about your own perception of what happened. So if you go through a traumatic event, say like losing your home or losing your job or having a relationship trouble or having someone pass away in your life and going through grief, those can all be considered traumatic events, and they can actually ultimately end up affecting your gut lining. Usually affects the mucosal layer first and our ability to produce mucosa, which has to do with the inflammatory pathways I was talking about. As soon as the mucosa starts to deteriorate, then the cells become vulnerable. When the cells become vulnerable, then our absorption surfaces, which are like these little villi, and if you laid them out, they'd be like the size of a tennis court. But that is your absorptive surface in the gut. And if those get damaged, they start to kind of deteriorate themselves. And that's what happens in celiac, and why they have such trouble with absorption is those villi have deteriorated. So this is kind of how disease starts and why it's like, yes, it comes with food, but it can also come with like an infection like Lyme, like Dr. Ward mentioned, or a mold exposure by living in a super dry state and having a leak in your water heater that you didn't know about. And then all of a sudden you have mold exposure that shuts down your entire body, which is like part of what happened to me. I had this, and this is why we know so much about this, is because we've all been through it in our own way. We've all worked on it, and we've all been through models that don't work, and they try, but sometimes it's not the right thing. Sometimes they are. Like antibiotics can be life-saving, and all the herbs and everything that we're talking about, like speak with your practitioner about it. This is not medical advice, it's education, but it's so that you can ask the right questions. And that's ultimately like what happened with mine, is like the stuff that I was doing just wasn't working. And then the stuff that I was put on changed my brain chemistry for like decades to come. And I've spent many years like getting it back to what is a normal state, because it's so much more complex than like a single neurotransmitter that needs to be worked on. This is systemic health. This is what functional medicine is. It's looking at interacting systems and knowing that they all play off of each other, and why we can't address just one thing. And then when we're talking about herbs or like, you know, killing things in the gut, that's not always the first move. It depends on where your body's at. And my body got to a state where it was so sensitive that I was allergic to supplements. And the only way, I was a functional medicine doctor that was allergic to my own tools. That was super frustrating. And all the lab tests didn't totally make the difference, because it didn't matter. Like I had to get my immune system under control. So I'm going to loop it back to the immune system and how we can get upregulated and why you get stuck in that 14-year cycle. So basically, if like I had a number of things happen where I was just stressed out and I was not trusting the world anymore. And my brain and my body were in this place where I was like, I feel like I can't escape, and I feel like I'm under attack. And then my immune system was like, oh, we're under attack. And my immune system went and totally upregulated everything. And that's an imbalanced state. But when this happens, one of the interesting things is that your immune cells actually go to your gut to become educated about how to function as immune cells. So if your gut is super inflamed, your immune cells are going to get educated in a way to function that is inflammatory. And then you continually, slowly over time, upregulate this inflammatory response. And then the only way to really get it down is to stop lighting things on fire. So you avoid the things that are making your body react, and it slowly starts to come down. And then for me, because I couldn't do that with supplements, I had to do it with meditation. And I went deep into meditation for months. And that was how I actually got my body to calm down enough that I could start to take supplements again. That would then help heal my gut and turn my body around. So it was this like huge learning process. And like, this is after knowing all this stuff, right? I was a practitioner when this happened, and it was an extremely humbling process. And learning that like, you have to address where people are at, and not like, a lot of people are like, oh, if I just pound the probiotics, that'll work. Actually, part of the way that probiotics work is they kill off bad bacteria. So they're technically killing agents. And I'll discuss it with people like, well, if you have a rabbit that's eating the vegetables in your garden, you can nuclear bomb the rabbit, which would be like some of the killing agents we're talking about, or you can hire some foxes to go and take care of them. And then as the fox is chasing them around and killing them, the dirt and the soil that your vegetables grow in, like your beautiful little microbiome that helps your body function, the dirt's all going to get torn up. So then we have to go and we have to lay down things to put the soil back into place. And that's going to be healing the gut lining, like Dr. Ward was talking about. So sometimes we have to start with like these nourishing things first before we dive into removing bad things, and then we can add in good things, and then we can foster it for the long term. And that's basically the model that I work in with clients, is seeing where you're at in your path depending on what you're going through, what your history is. I mean, my history intake form, sorry, but it takes you about 30 minutes to do, and there's a reason for that. Like I ask you about your birth, I ask you about stress things that are going on in your life, and then I also work on mindfulness with people, just like these gentlemen do. So anyway, sorry, there's my little soapbox, but I would love to hear your guys' thoughts on that. So whoever wants to go first.
Yeah, it seems like we keep going back to stress. So the father of stress was Hans Selye, and Hans Selye, I don't want to get into his experiments because it's like pretty brutal with those animals, but he still offered a lot to science. And what we learned from him is that the perception of fear really matters, and also the tension frame of the what Hans Selye called like the structural components, like ligamentous tension and stuff. When both of those combined, it adds just far amounts of stress in the body where you just don't feel safe. So I see a lot of questions in the comments like, where do I start? Like, how do I heal the gut? How do I repair my immune system? How do I feel like me again? Well, the first thing is first, you have to feel safe in your body. And if that means like sitting in a room where there's nobody around you and the door is closed and you can just close your eyes and know that there's no tiger chasing me, that little bit of safety, it gives you the gas to keep going on. So like you have to open the door to go to the next level, and that comes through safety and feeling like this is safety in your nervous system, really. And that's what chiropractic was founded on, is tone, how the nervous system is the regulator and the holder of tension in what Didi called the neuroskeleton, and we have to make sure we take care of this neuroskeleton in order to lay the foundation.
Yep,
absolutely.
Love it. Dr. Ward, any thoughts?
Yeah. I don't have a lot more to add. I'm trying to get trying to read through the comments here.
Yeah, I was actually just doing the same thing and looking at some questions. So I'll list a few and you can comment on those.
Okay,
so
perfect.
How bad is alcohol for leaky gut? Can we write down the names of the herbs? You guys can rewatch it later if you want. Sorry, it's a lot to manage all the questions and type stuff and talk.
Can I talk about alcohol for a second?
Yeah,
go for it. I'd love to hear it.
So alcohol depletes B6, and we need B6 to make antioxidants, and that antioxidant heals the leaky gut. So the antioxidant is glutathione. Alcohol depletes B6. We cannot turn methionine, which is an amino acid. In order for it to go all the way down to that glutathione antioxidant, it's going to need many vitamins and minerals. But in order to hop out of that circle, it needs B6. So that's the first thing I think about when I think of alcohol. You cannot heal leaky gut and drink alcohol at the same time, even if you're on a B6 supplement, because it is a full-on mitochondrial toxin.
Yep.
Yeah, unfortunately, alcohol is toxic no matter at any dose. And what I always think about alcohol too is it alters the gut microbiome every time you eat it, or drink it, sorry. But basically, like, I mean, we use alcohol as an antiseptic on like skin or to clean wounds, right? It acts like that in your digestive tract as well. So it's taking like almost like a small antibiotic when you drink alcohol. So if you try, and a lot of times, again, a lot of times we can tolerate it. A lot of times our gut microbiome is robust enough that we're okay. But if you're on a healing journey, you have to go off of alcohol. Unfortunately, it just disrupts the gut. There was something I wanted to say with the immune storm and the immune fire that we're talking about. Just a couple of tips of things to kind of down-regulate that. This is going to sound, you've probably heard it a million times, maybe. Vitamin D. Vitamin D is something that helps regulate the immune system. It actually calms down the inflammatory cascade. So a lot of you guys are probably deficient in vitamin D. Most Americans are and don't know it. So it's a really pretty cheap lab test you can get done, usually through your GP. And most of the time I see patients in anywhere from 18 to 30, I would say is the range that I typically see. You don't want it too high. I like to see it around 40 to 50 is my favorite range. 50 is pretty good. Maybe you guys have a different opinion. But that's one thing to help down-regulate some of that while you're also healing the lining, right? It doesn't really help to just take a bunch of that if you're not going to the root of the fire. Something else, too, that I like for just in a hyperactive immune system is actually echinacea. Echinacea stimulates T regulatory cells. Correct me if I'm wrong, but T regulatory cells basically tell the immune system what to do, like be active, don't be active, things like that. So that's a couple tips there for that.
And I do want to make the statement that no one item is the answer. Right. And you can take too much of things, which is why it's important to do things in a balanced way and work with a practitioner. Like, I love vitamin D and zinc, but if you take too much vitamin D, it can hurt your kidneys. If you take too much zinc, it depletes your copper, which affects your estrogen and like all these other things. So this is why we study this so much. And all of this learning, all the things that we're talking about, we don't really talk about this in school. We all spend, the reason we're good friends is because we all went through continuing education programs together after school as well. And we are regularly studying and regularly seeing each other at seminars and talking about the new research and what's out there. We're always learning. So like, if you're looking for a good doctor, it should be someone who's regularly learning and teaching and that kind of thing, because a lot of people forget doctor actually means teacher, which is why I do this, because we should be teaching our clients. I want to serve you and not only treat you. So one of the other things I want to comment on that popped up is fasting. And yes, fasting can be incredibly helpful at the right time with your body in the right state. Because if you are in a depleted state, or you're not absorbing nutrition, or your body is incredibly stressed, fasting can actually kind of harm you because it pulls on a lot of your resources. So you need to be in a state where you can actually handle doing that so that you don't end up pulling from your stores too much. So again, it all comes back to balance and timing and where your body is at and those kinds of things. But yes, fasting can have incredible benefits. It's the equivalent of meditation in a physical way for your body. It's that quiet space where your body's like, oh, I can finally take a break from processing all this stuff so that I can go around and clean up debris and then go and like nourish these things and build these things, which is great. But if you do it for too long, or you do it in a way that's not good for you, or like women, you probably should do it a bit differently than men, because we just have different hormone demands, and the time of the month that you're doing it, if you have a cycle, matters. And, you know, if you're like, I work with a ton of CrossFitters, and if you're working out super duper hard, like 3 to 4 days a week, fasting may not be the ideal thing for you, or the way that you're fasting might matter. So like, you know, doing like the 1 meal a day and then wondering why you're not losing weight, it's probably because your adrenals are too taxed from doing that. And it means that actually you might do better eating within an 8-hour window and doing very small things in between to keep your blood sugar balanced. And when your blood sugar is balanced, this is how we prevent insulin spikes. And when we prevent insulin spikes, then we affect things like brain health and liver health and all of this other stuff. So love to hear your guys' thoughts on that.
Yeah, I think so. We are a country of metabolic disease. It's ridiculous. They did a study, I can't remember which study it was, but they found 88% of American adults were metabolically unfit. That means their blood sugar health was not good. So only 12% of adults in the United States are actually considered metabolically healthy. So what that means is most of us, unfortunately, are on the fast track to metabolic syndrome, non-alcoholic fatty liver disease, diabetes, et cetera, et cetera. And if you do not have a plan or someone in your corner to help you have a plan, I really hope you're not part of the 88%. And so, and it's harsh, but it's true. And we have to face the reality so that we can protect ourselves and make good decisions accordingly. So I totally agree that whenever we're talking about chronic disease or fasting, things like that, we have to keep in mind that the point is metabolic health. And so if I'm fasting, which then stimulates huge blood sugar spikes and crashes, maybe that's not the goal right now for me. Also, I worked with a doctor. Her name is Dr. Mindy Pelz. You should look her up. She's amazing. She's like an expert on fasting, and specifically fasting for women in accordance with hormonal cycles. I was really honored to work with her and work in her clinic right out of school. I learned so much. And so I just recommend her as a resource. She has specific, it's like a cycle map, or I think it's a big circle. And basically it's a way to fast throughout the month and a way to eat, timing your cycle that feeds the different hormones that you need. So keto is great, but I saw a question about how can you avoid hair loss while you're fasting on keto? That's like a little bit of a yellow flag for me, that maybe keto right now in the way you're doing it is not appropriate. It's taxing the body too much. Fasting should not drain minerals and vitality out of the body so much that you begin losing hair. So I would examine that just to speak directly to it. But yeah, so you're right on, Dr. Christine, and that's pretty much what I have to say about that. So.
And there's one other comment that popped up. So one of them was like, okay, so avoid pharmaceuticals, but pump in supplements which are synthetic. Yeah, I can totally understand how people might perceive what we're talking about that way, but that's not what we're talking about. We're talking about a variety of modalities and options that are out there. I prioritize lifestyle medicine and food before I recommend any supplements ever, because if I just give you supplements and you're not making lifestyle changes, they're not going to work. And same thing goes with mindset, which is like the next comment, like without mindset, external elixirs are nil. Yeah, I couldn't have said it better. And this is why I focus so much on teaching people about mindfulness and teaching people about mindset and teaching you about your physiology, because if you understand what's happening to you, you're going to be a lot more motivated to not do things that make you feel bad.
Right.
And versus if I just tell you what to do and I don't tell you why, you're going to be like, okay, well, that worked for like a week. And so it's like, I'd much rather educate you on how to listen to your body and be like, oh, that did make me feel puffy and bloated, and I did gain 5 pounds in a day, and I do have a headache. Maybe I shouldn't eat that much cream. And just like thinking and being able to track things and identify things. And we're not saying avoid pharmaceuticals. We're saying that we work in a slightly different model. But if someone has an infection, you bet I'm going to refer them for a pharmaceutical. Like antibiotics can save your life, but sometimes I feel like they're overused. And that's stuff that, and we can't comment on when you should or shouldn't use it. That's not our realm. That is up to your practitioner, which is your general care provider, which is when we refer for that. But I like to work in conjunction with those providers, which is why I work with functional medicine doctors, because they are open-minded to understand that every single field has its benefits. I love massage therapists. I love acupuncturists. I love craniosacral I love counselors. I love medical doctors. I love DOs. The last interview I just did was with a DO. So it's like, I'm all about collaboration, and this weird mindset that has been created about like one profession is better than another. It's not true. We all have different things to offer, and really we should all be collaborating together for patient outcomes, not competing about what the degree is. It's about the knowledge and the information and the physiology and understanding how the body works. So we're not saying don't use any of this or use this instead. We're just talking about what exists, because some people have never even heard these concepts before. So just wanted to toss that in there.
I'm really passionate about that. There's a drug called Ozempic used to treat diabetes, I believe, and it basically gets you to not crave food. It gets you to lose weight, and what we talked about hormone wise, fat cells are a hormone factory as well. So that's just the other side, guys. Like, we're not saying we're anti drugs at all. So there's a time and place for it all. I think where our three voices become very powerful is when we do introduce that when the antibiotic is introduced into the patient's life. We're like, well, call us when that happens, because we want to give you Espulardi, we want to give you L-glutamine, we want to support your gut, while the Western medicine, their strategy is being incorporated, because once we get through that antibiotic, it's going to affect you for the next 6 to 9 months, maybe even a year. And I want to make sure I'm running parallel with you. And this is why I'm really, really, really passionate about this, is because physiology is physiology. Like my physiology textbook and medical physiology textbooks, it's the same biochemical pathways. We're just looking at it. Our tools are different. So there shouldn't be discord. There should be like, oh, okay, this is where you step in. Okay, this is where I step in. And it's like, it's about the patient at the end of the day. And the patient doesn't need to be in a place where they have to choose one side or the other.
No.
Everything can be super collaborative. And one of my first experiences working with patients was actually in a Lyme disease specialty clinic in California. And we often worked in collaboration with a couple of Lyme educated medical doctors. And there was a time for antibiotics in treating Lyme disease, in chronic Lyme even. People are really usually pretty familiar, like, oh, I got bit by a tick, I'm going to go ahead and antibiotic right away. But there is a point where you can stimulate the infection to basically come out. That's the other thing about Lyme. It ducks and hides. So there is no one solution to Lyme disease. And so you kind of often have to constantly go after it with a different approach. And so I'm really happy when a medical provider wants to collaborate and work together. And there are times for antibiotics as well. So, but the thing is that I think that we all agree on, and I think that hopefully all other doctors agree on, is that not everything is a nail that requires the hammer, to kind of butcher that saying. But and so when every time someone has a little kid has an ear infection, maybe we should investigate. It is in the research that antibiotics are overprescribed. And so it's not bad to be cautious about something, just as you should be cautious with me if I recommend you go on berberine. You should be cautious in questioning and reading and educating yourself. So
it's a really amazing time in human history. Like I feel like so many consciousness are clashing. And when you study history, when chiropractic was created, there was also a clash in consciousness. So it's like history is repeating itself, and the empowerment, we're trying to empower the people. I have a patient right now. He has really bad trigeminal neuralgia, which is like known as suicide disease, and he has shingles in the same pathway, and he's on many medications for a long time. And they went in his spine, and they did nerve blocking in the thoracic and the C-spine. None of it helped. I'm like, let's just try chiropractic care and strengthen your body again. He hasn't felt better, and we're like 8 adjustments in. He's still taking the same meds. So it's the same physiological pathways. We're just trying to empower you guys.
Yeah. And there's so many different approaches to things. And I think, I had a teacher once where I was asking them, like, well, if this works for so many things, like, why would you not just do that on everyone? He said, well, that patient might not be in the right space for it. Or that patient might need something different at the time, or they might need to enter in a different way. So I don't treat everybody the same, because everybody is different. And this is why we do such extensive history intakes and all of these things. And when it comes to like degrees, I want you guys to focus less on what your practitioner's degree is, and I want you to ask them what they do for their continuing education. That is going to give you a much better idea of where your practitioner is a specialist. And, yes, we are all doctors of chiropractic, and that's where we did our training. And a lot of people think of chiropractic and they think of like, a very quick adjustment and like you're out the door and that's all we do. Chiropractic is a foundational degree in physiology, just like medical school, just like naturopathy. We actually have more educational hours than MDs do, but they have more residency hours because of their requirements for residency. But all of us have trained under other mentors that are equivalent to residency. So it's just about where the education is focused. And chiropractors, if you look at the comparison of education hours, we have a ton more education in neurology and in nutrition, whereas medical doctors have more education in pharmaceuticals and chemistry. We have more training in radiology. They have more training in pathology. So it's just this slight difference in approach, but we all have the same foundational physiological education. It's what you need to pass your boards. And it is a very brief, like the 4 intense years of doctorate school is a very brief structure that you are then supposed to take the next few decades to fill in with continuing education and information, because it's a foundational structure, and that goes for every single degree. It's about how you educate yourself afterwards and how you apply the physiology to practice. And that is one of the reasons I actually chose a non-pharmaceutical model, is because you're educated to think differently about a problem and a solution when you don't have that as a tool. Not to say that it's not a tool that I think is definitely appropriate at the right times, but that's when I collaborate with my partners who specialize in that. Just like when they have a patient where their medications aren't working for trigeminal neuralgia, they send them to someone who really understands the nervous system, and we work with it in a totally different way. So it's like, it's about philosophy and approach to things, and no one is actually wrong. It's about where you're at and what you need and who you resonate with and what philosophy you have and what's working for you, or versus what's not working for you. And this is why I prefer to educate people about their physiology rather than about their diagnosis, because I think a diagnosis is just a form of vocabulary. It's just so that you can succinctly tell someone what's going on in your body without having to go into the physiological explanation. I don't necessarily think that there is like a one pill for one ill type of solution. It's not really how our bodies work. And sometimes a diet might be right for a little while, and then you might need to change it. And then same thing with supplements. They might be right for a little while, and then your body doesn't need that anymore, and you need something different. And this is why we do the kind of work that we do and the type of testing that we do, is because we watch this dynamic system that is your body and is you, to figure out what you need in this moment. And that is the definition of functional medicine, is what's going on with your body right now. You don't have diabetes yet, but your blood sugar is on the verge of it, and your liver's not functioning like we'd like it to. Let's work on those things so that you don't even end up with the diagnosis in the first place.
Love it. I just want to add, everyone, that like your health is way too important to just depend on one person to interpret it, to depend on one way of thinking to interpret it. And like, this is the age when you need a healthcare team with opposing viewpoints potentially, you know, because health is something that needs to be looked at from every angle. And so I just encourage you all to value yourself enough and your health enough to have multiple specialists looking at you. You know, it doesn't have to be, you know, all the time, you know, and multiple ways of thought examining your health, because it's worth it. So I just wanted to add that.
Yeah. And I saw a comment that said, new structure for continuing education needs to be a requirement for all practitioners. I couldn't agree more.
Yeah.
And I will say, like, we do have structures in place where you are required to get a certain amount of continuing education hours to maintain your license. I'm pretty sure that I have usually doubled what's actually needed. So like, I go to seminars that don't offer me continuing education credits because I don't care about the credit. I want the knowledge. And I go to enough of those that I ended up with significantly more credits than I need. And if you find someone who's only going for the credit, they're not really going for the knowledge in the way that I like to work with practitioners who think this way, which is why I brought these gentlemen on, because we think the same and we have the same appreciation for knowledge and continuing to educate ourselves with the most up-to-date research so that we can serve our patients versus only treat them, which is why I do these educational things.
Awesome.
Cool. Well, I know we're pretty much at the hour, and I could talk to you guys for multiple hours. We'll have to do this again sometime.
Yeah, this was awesome.
If people watching, and yes, we do speak at colleges. So if that's of interest, like, please message us, and we're happy to do speaking engagements because we love doing this stuff. Yeah. So send out a message, and feel free to comment on this video. I'm going to repost it. We'll keep an eye on it. We'll try to answer your comments and different things. If you are interested in working with any of us, just reach out. For myself, I have a link in my bio. You can click on that link. It takes you to all my information, upcoming courses, because it's like, I think one of the things run into the other comment I hear a lot is, oh my gosh, it's so expensive. I can't access it. And a lot of the evolution of healthcare and what people like myself and Dr. Janji and Dr. Ward do is we are creating more accessible ways for people to get this information. This is why I do this free stuff. Like, I just want you to be happy, and I want you to be healthy, and I want you to feel empowered in your life. And then if you need some more help, then we offer some pre-recorded courses if you're not wanting to interact with anyone yet. And if that, sometimes that'll resolve a lot of things for people. And then if that's not enough and you want engagement, then we also do like lesser priced group courses, because it's sustainable and we can charge less if we're working with multiple people at once. And then if you still need extra like in-person care, then you can move into the one-on-one model. So it's like, we're completely transparent about how we approach this. And it's the evolution of healthcare to provide you guys with other options. If I only offer you a cup of coffee and like that's the only thing you can get, it's going to be a lot harder to access than if I'm like, okay, well, here's a cup of coffee, here's a chai, here's a scone, here's water. Like, everyone needs different things at different times. And so we're trying to make things more accessible. So this is kind of how we like to approach things. So mine, you can click on the link in my bio. I think Dr. Janji and Dr. Ward have a similar thing. You can just go to their account. I'll let them speak to that.
Thank you so much. This was really fun. And I'm glad everyone enjoyed it. You guys were a great group.
Yeah, thanks guys for tuning in. And yeah, I got a link in my bio too. You can reach out to, I'm at a practice in Florida. If you guys want to say where you're from, I don't know if you want to, but Dr. Christine's in Colorado, Dr. Janji's in California. So we all have our websites in our bio. I'm happy to answer any questions and see if we can help you guys out, all right?
Yes, and please comment on the video and put questions there, and we'll answer as much as we can. We can't answer things like specific dosages online because that's not how your body works. And this is the definition of customized medicine, is not giving specific dosages without taking someone's proper history and looking at their blood work. So so that's why we can't answer those questions. So sorry if you asked those. But when it comes to like topics that you want to learn about and you want us to do another one of these, comment with what you want to know more about and we'll design it around you, because we like doing that. So anyway, thank you guys for joining. Thank you guys for taking the time to do this, and I'll look forward to the next time.
Thanks, Dr. Christine. Appreciate it.
Thank you, Dr. Christine. Appreciate you.
Bye. Appreciate you too.